All right, we are wrapping up the urinary system here in this last video for section 4 of this chapter, where we're going to look at the rest of the urinary tract that is outside of the kidneys. So outside of the kidneys, the remaining structures of the urinary system, their job is to transport, store, and excrete urine. So move it from the kidneys to storage, store it for a while, and then get it out of the body. And those structures are going to be the ureters. They're going to do that transportation of urine. The urinary bladder is going to store it, and then the urethra will finish out that excretion process. So the ureters, these are also retroperitoneal. They're two tubes connecting the kidneys to the urinary bladder. They are continuous with that renal pelvis, so the renal pelvis is directly transitioning into these ureters. They are made out of some smooth muscle, so they will have peristalsis, just like the digestive system does, to help move that urine into the bladder. And then there is something called a physiological sphincter that is entering into the actual urinary bladder, and its job, just like the sphincters of our digestive system at either end of the stomach, is to prevent reflux backwards in that entire system. We don't want that urine flowing in the opposite direction that it is designed to flow. So physiological sphincter is a little bit different than an anatomical sphincter. So the sphincters we looked at with the stomach are anatomical sphincters. They're rings of muscle that are going to physically block off that reflux. Whereas the physiological sphincter is a little bit different. So as the ureters transition into the pelvic cavity and get close to the bladder, they're actually going to enter the bladder at what's called an oblique angle. So not directly on, where it's just going to be like plugging a tube into something. And this basically creates a one-way valve, much like what we see in our veins. So the ureters are going to have some mucosa with transitional epithelia cells and goblet cells for production of mucus. And then we've got that smooth muscle, both longitudinal and circular, for the peristalsis. And then there's also adventitia, which has collagen and fats to help anchor it into that posterior abdominal wall to keep them from moving around in the body, which could lead to twists or bends in it, which is going to prevent the flow of that urine. So here is a micrograph. So this is a cross-section of a ureter that's been put under a microscope and artificially stained. So here's the lumen, so that opening where the urine would actually pass through. We've got our smooth muscle layer here, and most of this pink tissue. The more purple tissue is going to be that inner mucosal layer, so the transitional epithelium and some of the goblet cells in there. And then the adventitia further outside that is going to fuse with the outer layers of the ureters, but then also with the rest of the body. Sorry, my dog is apparently on high alert about something. Say hi, everyone, Mia. Mia says hi. Sorry. All right. Next up is the urinary bladder. So the urinary bladder is partially retroperitoneal, so it doesn't fit fully behind the peritoneal cavity, but it does sit partially behind the peritoneal cavity, and that peritoneum is going to cover the top of it, so the dome is what that's called. It's going to receive that urine from both ureters, so we have two ureters, one for each kidney, and the urinary bladder has a lot of transitional epithelial cells in it and mucosa. And then we have special muscles located in the bladder, the detrusor muscles. They crisscross the entire structure of the bladder, which will help force urine out, but also allows them to expand or distend as the urine builds up. So here is a cross-section of the urinary bladder. So here is that peritoneum right here covering that upper portion. The ureters are coming in right here. And again, the angle that they're entering at down here, the ureteral openings, is kind of at a slant so that the urine isn't entering super, super quickly and it can't flow backwards and up out of the bladder. You can see here in this cross section, the muscle layer is all in these different sections. All of these fibers are going to go in different directions. And again, that allows expansion of the bladder as it fills with urine, as well as allowing all of these muscles to contract to fully force urine out of the bladder to empty it completely. Here's a micrograph over here showing that transitional epithelium, submucosal layer, muscle layer is going to be out here. That transitional epithelium is also really important for the bladder's ability to stretch as it fills, while also offering protection to these layers underneath, because urine's going to be very destructive to different cells. So we do still need that mucous membrane covering it, much like we see in the stomach with that high acidity environment. So that transitional epithelium helps this be able to stretch while still maintaining that protective coating. Next up is the urethra. This starts at the trigone of the bladder, which is, again, this triangular shaped structure right here, and it directly connects into the actual urethra. So the upper region of the urethra also has transitional epithelial cells, just like the rest of the bladder does. The lower region is going to have non-keratinized stratified squamous epithelial cells. So again, our skin, the epidermis especially, is made out of stratified squamous epithelium, but it's keratinized, which gives it that harder protective coating. And we just don't need that inside of the urethra. So these are non-keratinized cells. It is going to have a couple different urinary sphincters, the internal and external urinary or urethral sphincter. The internal one is the upper one. It's more superior. It is made out of smooth muscle and it is involuntary. Whereas the external urinary sphincter is inferior, so it's closer to the bottom, and it is made out of skeletal muscle and is therefore voluntary. So again, coming back to this image, so that internal urethral sphincter is right here as the bladder and trigone transition into the actual urethra itself. So right there at the base of the bladder. And then a little bit further down is going to be the external urethral sphincter. Right here, this will be another circular muscle, but if we chop it in half, we're only going to see part of that circle right there. And that's skeletal muscle under voluntary control. So the rest of the urethra, or the entire urethra rather, is going to look a little bit different depending on what somebody's reproductive organs are. So in an individual that has testes and therefore a penis usually, it's going to be much, much longer, so about 20 centimeters long. It will pass through the prostate gland, which we'll cover in the reproductive chapter. And then there are some different sections to it. Pre-prostatic, so before the prostate, the prostatic urethra as it passes through the prostate, membranous, and then spongy or penile urethra, which is going to make up most of it. On the flip side, in individuals that are going to have ovaries and a uterus, it's much, much shorter, so only about 4 centimeters long rather than 20. It's located in between where the clitoris and vaginal canal would be, and it is more susceptible to urinary tract infections for a couple different reasons, and we'll talk more about that here in just a little bit. So here is a sagittal cross-section of the two orientations of the reproductive organs and their relation to the urinary system. So over here on the left would be an individual with ovaries and a uterus. So here's the uterus right here. Bladder is going to sit generally underneath it in roughly 90% of the population that has this anatomy. The uterus will sit over the top of the bladder. That's not true for everyone. We'll talk more about that in the reproductive chapter. But here's that bladder. Here's going to be the urethra right there, very, very short. Whereas in an individual who has testes and a penis, that bladder, we don't have that additional reproductive organ sitting on top of it. This would just be intestines. And then the urethra is going to pass through several structures as it makes its way out of the body. And so the biggest reason for why individuals with ovaries and a uterus are more susceptible to urinary tract infections is because this is very, very short. And so bacteria don't need to travel as far to get up the urethra into the bladder and start causing issues. The other reason for this is because a lot of the bacteria that cause urinary tract infections, one of the big ones is E. coli. These bacteria are found naturally in the digestive system, in the intestines. And so in an individual with this style anatomy, the anus, where all of that fecal matter and therefore bacteria would be coming out, is very, very close proximity to the urethra, and this very, very short urethra at that. Whereas in an individual who has a penis, where that urethra is passing through an entirely different organ, coming out of the body at an entirely different location that is far away from where that anus is, where the bacteria would be coming out. So the chances of that bacteria being able to get up the urethra is far, far lower. It is not impossible. Individuals with this anatomy do still get urinary tract infections. It's just not as common because of how the anatomy is set up. Last but not least, we're going to talk about the micturition reflex, which is the urge to urinate. And so the micturition reflex is just the official anatomical term for urination, or the urge to go to the bathroom or urinate. This is controlled by the nervous system in conjunction with the two different urinary sphincters. So we'll talk more about the nervous system here in a couple more weeks, but we have a few different divisions of our nervous system. The autonomic nervous system, autonomic for automatic. So this is the involuntary division of our nervous system, whereas the somatic division is voluntary control. This is our conscious control right here. So again, that internal sphincter made out of smooth muscle is under automatic control. This is involuntary. The external sphincter with the skeletal muscle is under voluntary control. And then we have three main nerves. The hypogastric, pelvic, and pundial nerve are all going to play a role here. So we're not going to go into a ton of detail about these nerves, but it can be helpful to kind of know what these different nerves are doing. So this is just showing one particular setup for different anatomy in an individual. But we've got some innervation here of that external urethral sphincter. Again, the internal one's going to be right here. And so what happens is, as the bladder fills with urine, it is going to slowly stretch out. And between the stretching and the pressure on this internal sphincter, that is going to start signaling some of these different nerves to tell the brain that the bladder is getting full and it is going to need to be eliminated soon, have that urine eliminated from the body because we're running out of space to store it. And so that internal sphincter is the first area really that starts getting that signal and starts Yeah, starts getting that process going, all of those nerve signals and everything to the brain. And it's this external sphincter that we get to control, that allows us to actually reach a bathroom where we can relieve ourselves. And this can be trained, obviously. This is why we have to potty train kids. We can obviously potty train pets as well, especially dogs, to have that conscious control over it, because we are not born with that conscious control over the external sphincter. I mean, it is still under conscious control, but we don't really think about it quite as much. It does need to be trained. This also ties into incontinence. So inability to maintain that external urethral sphincter, and prevent urination at times that you don't want to. So, incontinence is when that sphincter and that signaling for the nervous system starts failing. Generally speaking, as we age, because just like every other part of our body, these cells and tissues are going to kind of start breaking down over time as we age. And that wraps up the urinary system.